My name is Carmen Solorzano, and I'm the chair of the Department of Surgery at Vanderbilt University Medical Center. I believe Vanderbilt is a very special place because we take great care of our patients in a personalized way. We also advance innovation and your education so that you can be the best surgeon to your patients. So thank you very much for allowing me to introduce VUMC to you.
Hi everyone, I am Christina Bailey. I am the General Surgery Residency Program Director at Vanderbilt. As a former trainee, I can honestly say that Vanderbilt is a wonderful place to train. As a Vanderbilt graduate, you will be a confident and competent general surgeon. If I had to pick one thing that has impressed me the most about Vanderbilt, it would be the people. From our residents to our faculty and our support staff, we are a family. So thank you for your interest in our program, and thank you for taking the time to view our virtual tour.
My name is Andrew Medvets, and I'm one of the General Surgery Chief Residents. I'm going to take you on a tour of Vanderbilt University Medical Center's campus and give you an overview of the Vanderbilt General Surgery experience. Vanderbilt is one of the largest academic medical centers in the Southeast. The medical center's campus in Nashville, Tennessee is home to over 95 training programs with over 1,000 residents and fellows per year. Our general surgery program welcomes 27 interns per year, 8 of whom are categorical residents. As Vanderbilt General Surgery residents, we have the opportunity to care for a large variety of patients, not only at VUMC, but also the Tennessee Valley Veterans Hospital and Monroe Carroll Jr. Children's Hospital at Vanderbilt without ever leaving campus. We also have opportunities to go off campus as well, including rotations at a local community hospital and an international experience in Kijabe, Kenya. At VUMC, we are immersed in many nationally recognized programs, including trauma and surgical critical care, burn surgery, surgical oncology, and transplant surgery. For instance, VUMC is the only Level 1 trauma center in Tennessee serving both adults and children. We have 5,000 trauma activations per year, 10 to 15% of which involve penetrating injuries. As residents here, we gain extensive trauma experience at multiple levels of training, from intern year to leading the trauma team as a chief in the 4th year. VUMC is the only dedicated burn center caring for adults and children in Tennessee. Our residents train with both general and plastic surgeons in the operating rooms and alongside surgical and anesthesia faculty in the ICU to gain a well-rounded approach to burn management and critical care. VUMC is the only National Cancer Institute designated comprehensive cancer center for adults and children in Tennessee. We are fortunate to train with our superb surgical oncologists, including our program director, Dr. Bailey, and chair, Dr. Solorzano, learning to care for patients with complex solid organ malignancies. Vanderbilt is also one of the largest transplant centers in the U.S., and our residents are situated right at the heart of the action. We have a rich transplant experience with opportunities for early leadership, serving as the chief resident on kidney transplant as a 3rd year and liver transplant as a 4th year. Our setting in Nashville draws patients from a large catchment area to Vanderbilt's doors. This means we get extensive exposure to the gamut of general surgery problems, from routine and uncomplicated to rare and acute. Our EGS service covers it all. We work closely with our surgical intensive care unit teams to care for our critically ill patients. When we are not practicing our maximally invasive skills, we are learning advanced minimally invasive surgical techniques in every field, from pediatrics to complex hernias to surgical oncology. We gain experience with robotic cases both at VUMC and the VA, which is guided by a formal, hands-on curriculum. Monroe Carroll Jr. Children's Hospital at Vanderbilt is just a skybridge away. We work closely with pediatric surgery faculty and fellows throughout training. You're sure to nail down more than a laparoscopic appendectomy there. Like the Children's Hospital, the VA is also located on Vanderbilt's campus, so the veterans of Middle Tennessee are also just a short walk across the courtyard. The VA is where we earn our stripes both clinically and operatively. Our residents direct the general surgery, thoracic, transplant, and vascular services at the VA, a true testament to the training that Vanderbilt offers. At the end of the day, Vanderbilt is a place where you learn to work hard to care for your patients, but also where you're respected, supported, and valued as an individual. VUMC is also a place where education is a priority. Our teaching conferences are spearheaded by residents, so you leave this program prepared not only as a clinician and technician, but also as an educator and leader. We wouldn't be able to do all of this hard work without the support of the General Surgery Department and program leadership who help us balance operative and clinical demands with education and our lives outside of the hospital, including the occasional team lunch or happy hour at a nearby restaurant. I hope you enjoyed this brief glimpse into the world of Vanderbilt General Surgery. Thank you so much for watching.